Is it the same line? Start. Okay. Welcome to our YouTube channel, and today we are live on YouTube and TikTok. Thank you so much for joining. Those on YouTube, you had gotten a few challenges, but we've now stabilized. So call the colleagues back. Okay. So today we are going to straight away be answering questions. Good afternoon, good evening everyone. Those of you watching from wherever you are, those of you watching from Uganda, my followers from Nigeria, from UK, from everywhere. Happy to meet you again today. So I'm going to be answering questions, medical questions. Just chip in your question and then we see what to do. I'll straight away start with all these ones are just greeting me. Marcelo Mokua is saying, hello doctor. Hello, good evening to you. So this one is saying, okay, Masse Mweri is saying, hello doctor, I just have a question. I have tried to conceive, but I'm not. Please help me. I need a child. Masse Mwale, you need a child, you fail to conceive. First of all, I want to know what your age is. Let me know how old you are. How old are you, first of all, before we get to understand your problem. Let me know how old you are, how many children you have, whether you've ever conceived or not, do you have menstruation, etc. Give me those answers and then we tell you what we can do. Then this one is saying, Kelly Faith is saying, please, what fruits and vitamins can one take to get pregnant? Now, Kelly Faith, I want everyone to understand that there are no fruits, there are no vitamins that can make you get pregnant. Because there are several reasons as to why someone fails to get pregnant. It can be as a result, probably you have a pathology, you have a problem with your uterus, you have a problem with your hormones, you have a problem somewhere in the reproductive system. So therefore, usually when people ask for those vitamins and so on, you give them, maybe you tell them take vitamin C, take folic acid. For them, they will take that, and when they don't conceive, they will say, the doctor told me to take such and such vitamins, I am not conceiving. So if you're not conceiving, you know what to do. Identify the cause why you're not conceiving, then you can get, but you don't need to take those. But of course, there are some vitamins we know that they are good for our reproductive health. For example, folic acid is good. Okay, vitamin D, vitamin C is good. All those vitamins are good. The acetyl N coenzyme, the coenzyme YX, all those ones are very good and they can boost your fertility. However, if you have an abnormality, for example, you have blocked tubes, still those vitamins will not help you. Let me continue with the questions. This one is saying, Doreen Tindimweva, good evening doctor, can Rimona and M2 tone be taken together to cure amenorrhea and an ovulation caused by polycystic ovarian syndrome? Now, Rimona is used for polycystic ovarian syndrome, but M2 tone, all right, of course, it's also a supplement. Yes, they can be used to treat polycystic ovarian syndrome, though they are not the exact medicines used for amenorrhea. So for them, Rimona and Rimona especially can be used to treat polycystic ovarian syndrome, but don't focus it so much on amenorrhea. Then we have someone is called Nalika Justin. Can I meet you, doctor? I need a dating scan. All right, if you want to meet us, you can come to Bikoff Medical Center in Masaka. Then we are in Masaka and the scan is there. It can, of course, date your pregnancy if you want. Then this one is saying, Stephen, phone is good, doctor. I'm Stephen from Cameroon. I wish to know What time for a newborn baby I need to stop breastfeeding? Okay. Breastfeeding, we usually advise people to spend at least 2 years. At least 2 years. 2 years of breastfeeding is good for someone to, for a child. But of course, you know when you're breastfeeding, even when you're breastfeeding at 6 weeks, you can easily conceive. Let me get some few questions from TikTok. Oh. Okay. Let me just have a second. I come back. Just a second. These questions, let's pick up these questions very, very fast. We have someone is saying, hello doctor, I'm not ovulating, what can I do? If you're not ovulating, you're going to do a fertility hormonal assay. Mainly you do a follicle stimulating hormone and luteinizing hormone. When they are low, you can take medicines. If follicle stimulating hormone is low, or LH is low, you can buy clomiphene or clomid, or you can take letrozole. And for letrozole or clomid, you can take them depending on the length of your menstrual cycle, but they're supposed to be 100 milligrams once daily for 5 days. You can take those medicines. Of course, you'll have your ovulation if at all the problem is with your hormones. Then this one is saying, what causes infertility after one ectopic pregnancy for many years? Yes, after an ectopic pregnancy, you can get blocked tubes. Mainly, blocked tubes will cause infertility after an ectopic pregnancy. Let's get some questions done on TikTok. This one is saying, hi doc, I have taken 2 months without having my periods and I am not pregnant. What could be the cause? Yeah. Taking 2 months or taking, of course, missing your periods is called amenorrhea. So it can be caused by, number one, you may be having hormonal imbalance, and specifically the hormone or the culprit hormone there is progesterone. If you have low levels of progesterone, you may fail to go into your periods. Also, a hormone called prolactin can cause amenorrhea. Then people with fibroids, with endometriosis, people with adenomyosis, all those diseases can cause amenorrhea. So if you're not menstruating for that period of time you've talked about, then you're likely to be having a problem with that. And what you're supposed to do is to go and do a fertility hormonal assay and a pelvic ultrasound scan to identify what is causing the problem. Then someone is saying, okay, questions here, many questions here. But let's have this one. It's saying, doctor, my cycle is 21 days. Calculate for me the length of my, okay, calculate for me ovulation. If your cycle is 21 days, those people with a 21-day cycle, this is how you can calculate your fertile days and safe days. So if the length of your menstrual cycle is 21, your cycle is 21 days, okay? People are not seeing you. Okay. If your cycle is 21 days, what you're going to do, say 21 minus 18, you get 3. Then 3 plus 4, you get 7. And then 7 plus 5, you get 12. So what does it mean? Your safe days are from day 1 up to day 3. Then at day 3, you're fertile. It means you can get pregnant from day 3 up to day 12. And then on day 7, this is your ovulation day. This is your ovulation day. day 7 is your ovulation day. So everyone, if your cycle is 21 days, then it means your ovulation day is always on the 7th day. So such people with 21 days, everyone with a 21 days cycle, the ovulation day is on the 7th day of your menstrual cycle. And I told you that if you're calculating your, I told you that if you're calculating your those days, when we say 70 days, your ovulation is on the 7th day, it means that you're supposed to start counting from the day you see blood. You see that there is a problem with some of you. Usually ask me your ovulation day, I let you know your ovulation day, I let you know your safe days. But the problem is that you start counting those days when you stop periods. When you stop periods or when you stop seeing blood, that's when you start counting. But I told you that start counting your days from the day you see blood. The day you see blood like this, today, that is the first day of your menstrual cycle. So if we tell you that your ovulation day is on the 7th day, it means that you start counting from the day you see blood. Even if it's just little spotting, that day you've seen blood is the day you have to start counting. Call your colleagues very fast because today we have less time. We are going to only use 1 hour. So exactly 1 hour will be enough for us. But I'll make sure that I answer those of you who will have sent in your questions. This one is saying, I have polycystic ovarian syndrome and I use Fertilon F and no results. Please, what can I do? Polycystic ovarian syndrome, most people, you can use Rimona. Rimona is okay. But again, I want to advise you that whoever is having polycystic ovarian syndrome, you should also follow because with polycystic ovarian, I know you have done those tests to confirm that you have polycystic ovarian syndrome. But something else you're supposed to do is also to do a fertility hormonal assay. When you do a fertility hormonal assay, it will also help you when you're getting this treatment. Like if you start using the Rimonas of this world, those medicines like the Fertilon is talking about, you may also need to stabilize your hormones. And therefore, you have to use these medicines for PCOS as well as medicines for fertility hormones. I hope your question is clear. Then we have someone is saying, hey doctor, can you get pregnant when you swallow a pill after 24 hours? During your fertile days. Now, when you take emergency pills within a period of 48 or of 24 hours, it's unlikely that you will conceive, because we usually give you 72 hours. Actually, some people, sometimes you can even go up to 5 days. Okay, but to be on the safer side, when you have sex like today, the first day, if you have sex like today, make sure that you swallow that pill within a period, within 72 hours. That is 3 days. If you swallow beyond 3 days, then there are chances of conceiving. Monetized? Sure. So then this one is saying, Safia Ahmed is saying, hello doc, I just have a baby 3 months ago, but I'm having extreme hair loss, especially the frontage. Thanks. Okay. With hair loss, I think with this one, you need to do some tests. Go to the hospital and do a fertility hormone. Do hormonal tests. You do several tests to identify what is causing this. Maybe you're taking some medicines, because hair loss can also be caused by medicines. Some medicines we take can cause that hair loss. The medicines you're taking, it can be as a result because there is hormonal interplay. Usually there can be hormonal interplay when during pregnancy. All the things can cause hair loss. So the best thing is to do tests and identify the problem. All right, then Alimani Anthony from Alimani Anthony Kote is saying, good evening doctor, I'm Alimani Anthony Kote from Sierra Leone. Hey, say hi to the Sierra Leones. How is someone from Sierra Leone called? So tell us down how people from, because me I'm from Uganda and I'm a Ugandan. So how is a person from Sierra Leone called? So you're saying, I want to know what fruit is good female what? Your question is not complete. Let's have someone say, blessing Ebiri, my cycle change after family planning. Of course, the cycle changes after family planning, especially when you've used a hormonal method of family planning. Akandwanaho Janet, you're saying, hey doc, well done, thank you. Stephen Phone is saying, is it possible for a just newborn mother menstruate after 1 month? Yes, it is very possible. Actually, we usually say that a woman who has delivered can take up to 6 weeks, that is 1 month and a half. But there are those that resume their menstruation early. As early as 4 weeks, you can find a woman having their periods after giving birth. So it is not an abnormality, it is something that is very, very possible. Then we have Sandra SC is saying, hi doc, what causes cervix block? What do you mean? What do you mean by cervix block? Please elaborate your answer. But maybe you're talking about cervical blockade. Okay? If you're talking about cervical blockade or blockade of the cervix, it can be as a result of an injury to the cervix. For example, if those people who have done dilatation and curettage, those people who have had abortions, that can cause a cervical blockade. So either if you had a pelvic surgery, you had a pelvic manipulation, or you had a dilatation and curettage, infections can cause cervicitis, which can also lead to blockade, and so on. All those things can cause cervical blockade. This one is saying, Nalika Justin saying, what is the name of your hospital? Okay, the hospital is called Beecroft Medical Center. Beecroft Medical Center is found in Masaka City. That's where we are found, Beecroft Medical Center. This one is Giedol, this name, Giedibor Kailing. Doctor, I feel symptoms of ovulation, but I can't get pregnant. What should I do? You see, now, this is what I've always been talking about. You feel symptoms of ovulation, but you're not getting pregnant. Who told you that whoever ovulates has to get pregnant? That is not true. You may ovulate when you have another problem. You may ovulate when you have fibroids. You may ovulate when your tubes are blocked. So you still not conceive. So what you need to do is to do, first of all, go and do for me an ultrasound scan. Go and do an ultrasound scan, a pelvic ultrasound scan, or a CT scan. Then go and do for us fertility hormonal assay. Fertility hormones, check for the level of your fertility hormones. Then after that, you come back on the next live. We are going to be live again next week on Thursday, and we shall be starting still at 7. So you come back with those results. Let me look at those results, and then we get to understand what is causing that. But having ovulation doesn't automatically mean that you are going to conceive. Right? Let me also answer some people from TikTok here. They are asking many questions here. Okay. Okay. This one is saying it's firstborn. Someone is called firstborn. People on TikTok have funny names. I'm new on TikTok. I'm not so conversant with TikTok. You people have to teach me. Now I'm seeing someone is called firstborn. Firstborn is saying, I have repeated periods twice this month. What could be the cause? It had never happened before. The cause may be the reason as to why you've repeated periods twice in a month. It can be as a result of you taking emergency pills. Maybe you took some emergency pills or used any family planning method, or you had stress. Sometimes having stress can cause repeated periods, or having periods twice in a month, that is to say intermenstrual bleeding. So all those things can cause that. Princess, how are you, and where are you calling from, and what's your question? Be louder.
I'm fine, sir. Good evening, sir. My name is Esther. I'm calling from Africa.
Be very loud.
So my question is, if someone wants to conceive a baby boy, what would that person do?
All right, if someone wants to conceive a baby boy, all right, let's go to this board. Someone wants to conceive a baby boy. All right, now listen carefully. Listen very carefully. If you want to conceive a baby boy, Now the first question will be, what is the length of your menstrual cycle?
My menstrual cycle. I'm 30 days.
30 days, all right. So please stay on. Now, the length of your menstrual cycle is 30 days, okay? So, get for me this calculation. Are you seeing? I don't know if you guys on TikTok are seeing. Okay, let's do this. So, 30 minus 18, what do you get? Princess, what do you get? If you don't answer, I'm not also going to give you the answer. 30 minus 18, you get what? Okay, someone give me an answer here. 12. Nena is saying 12. Someone is giving you 12. So you've copied. People on TikTok, they are giving you the answers. They have given you the answer. You didn't know. You didn't know simple arithmetics. All right. So 12. You get 12. Okay? So 12 plus 4. What do you get? You see, you're waiting for answers from these people. It is what? 16. 16. Where are you calling from? So 16 plus 5, what do you get?
16 plus 2?
Plus 5.
Is it 2 or 5?
5.
21.
Okay, 21. You're copying from these people. There's someone called Anena. She's very. All right. So now, if your cycle is 30 days and you want to conceive a baby boy, make sure that on the 16th day you meet your husband. On the 16th day. On the 16th day, there are very high chances of conceiving a baby boy on the 16th day, if your cycle is 30 days. Now, also, on the 15th, actually on 14th, 15th, and 16th, these days you can conceive a baby boy. But 14th, not very accurate, but these days, 2 days, 15th and 16th, you can conceive a baby boy. Are we together? So try those days, you'll be able to conceive a baby boy. Is that all you wanted to ask? I think that's all you wanted to ask. Let's also have other friends of yours. Thank you so much. Where are you calling? Where have you been calling from?
Okay.
Okay, nice time.
Hello.
All right, so we have someone else is called Ilinda Mulela. Hey, doctor, I'm having pain in the right breast. What could it be? All right. Pain in the right breast or pain in the breast can be caused by mastitis, can be caused by mastitis. It can be caused by engorgement, or because there can be engorgement of the breast, especially for women who are breastfeeding or they have just weaned off their children. It can also be caused by the way, masses, when we talk about masses, we mean tumors. You may be having a tumor there, you may be having a cancer there. So all those things can cause breast tenderness. But also ovulation. Ovulation can also cause breast tenderness. Not only ovulation, but also some women, when they are going through their periods, they can have breast tenderness or breast pain. Linda, okay. Blessing Ebiri, my cycle changed after family planning, and my question now is going back to my normal. After family planning, it is advisable to, at least after family planning, especially when you're using hormonal methods of family planning, it is advisable to first leave your body free from those hormones for at least a period of 6 months. When a 6 month period passes, periods can stabilize. So don't worry, you can first allow your periods they can stabilize in 6 months. So you can first wait and give it 6 months. Please, I think you can get off. Let me have some other people. You asked your question and I answered you, isn't it? So let's have someone else.
I want to ask you something. 15, 16 that will also conceive twin baby boys? Is it the same day? The same day?
If you want a baby boy, we've said you'll have sex on the 15th and all 16th day. Those 2 days can give you a baby boy according to your menstrual cycle.
Okay, I said twins, baby boys.
Twins, then that's not how we do it. Twins, you'll have to go do some tests and get medicines. There are some medicines that you can be used to stimulate your follicles to produce at least 2 eggs, and then you can conceive twins. All right, nice time. Let's have other people to ask, please. This one is called Camila, but you can stay on. This one is called Camila. Camila is saying, hello, doctor, how can I get a baby girl? My cycle is 21 days. All right, a 21-day cycle. Those of you who have a 21-day cycle, this is how you're going to do it. So 21 days, we said... if your cycle is 21 days, L equal 21, you'll say 21 minus 18, you get 3. 3 plus 4, 7. 7 plus 5, 12. So if you want a baby girl, now avoid sex on the 7th day, okay? Do not have sex. If you want a baby girl, don't have sex on this day. Don't have sex on this day. Don't have sex on the 6th day. Don't have sex on the 5th day. So what you're going to do, from day 1 up to day 4, you can have sex. There are chances of conceiving a baby girl. And also from day 8, okay? Day 8 up to day 12. So have sex from day 1 up to day 4, or day 8 up to day 12. That will be a baby girl. I think that is very clear for you. Okay. That will be very clear for you. All right, so let's have this question. Please, those of you have invited, mute yourselves. I will invite one by one to ask their questions. First, mute yourselves so that we can have a few questions on YouTube cleared. Mute yourselves. If you don't mute yourselves, I will then take you off. I'll invite you one by one, please. So let's have this question. Mutuzo Rachel is saying, but doctor, how come I got pregnant after swallowing that pill after 24 days? Some of the reasons as to why, please mute yourselves. If you don't mute yourselves, I'm going to take you off. So some of the reasons as to why some people conceive even after using emergency pills. Some of the reasons as to why some people conceive even after using emergency pills. Number 1, those pills may be expired. Some of you take emergency pills when they are expired. That is number 1. Number 2, poor dosing. There are some emergency pills where you're supposed to take 2 tablets. 1 tablet taken and then another one taken after 12 hours. Some of you, you take 1 and you don't take another one. Then at times also, by the way, emergency pills are not 100% accurate. Therefore, you can take them and still conceive. All right, let me start with Zibarif. Zibarif, how are you? Where are you calling from? And what is your question?
Hi, doctor. I'm calling from Nairobi, Kenya. And I have 2 questions. Number 1 is, my cycle is 32 days. So when do I ovulate?
Is 22 days? Is 22 days? 32.
32.
When do you ovulate? Is that the question?
Yes.
All right. I will invite only one question in order to allow everyone to ask, because we have... Okay. So you have 32 days. 32 days cycle. So I want you to give me answers. 32 minus 18, what do you get?
18.
You get 18. Okay. if you give a wrong answer, you'll get a wrong result. So 32 minus 18, you get 18. Okay. 32 minus 18, you get 18. Why don't you ask your friends to help you?
14.
Eh?
Oh, 14.
You get 14.
Yes.
Okay. Yeah, someone is helping you. Princess Fahi, say thanks to Princess Fahi. He's giving you the answer. I think she's the one that has given the answer. No. So 14. Then get 14 plus 4. What do you get?
18.
18. Okay. So you wanted your?
Ovulation.
This is your ovulation day. From day 1 up to, calculate 18 days. And you start counting from the day you see your periods. Then on the 18th day, that is your ovulation day.
Okay, so doctor, can I ask one more question, please?
Okay, one. Short and be fast.
Apart from medicines, what other thing can trigger my ovulation?
Apart from medicines, what else can trigger your ovulation?
Yes, naturally, like foods or
No.
I've seen online they say cloves.
There are no known foods that can trigger ovulation. Those are speculations. They are not proved scientifically. Many people talking about a year taking cloves, a year. There is this Nigerian food. Is it true? Some Nigerian, please comment here and tell me that food. Is it fufu? Something. There's some type of food. I usually receive my Nigerian clients telling me that there is a certain food that someone can eat. You can eat that food and then you simulate ovulation and fertility. That is not proved, and it has no scientific basis. Someone from Nigeria, please tag for us the name of that food they usually talk about. I receive many from my inbox. Those people talk. Okoro, thank you so much. Princess is saying that food is called okoro in Nigeria, and people think when you take that food, you get ovulation. So, but that is not proved scientifically. Okay?
Thank you so much, Doctor.
Welcome, and say hi to those Kenyans. Say hi to Ruto and everyone. I know you'll not see him.
Okay, definitely. Bye.
All right, bye. Let me get this question done also. Those of you still there, please keep there. I will invite you when your time comes. Then we have someone saying, Bridget Einiemaweni Peter. Oh my God, this name. Good evening, I'm watching from Lebanon. Thanks for all your good job. God bless you. Please, is it possible to have your number to make an appointment? Sorry, I don't give out my number because we have very many people. But for you on YouTube, yes, good, very good. You check down those words passing there. Then you log into my website www.druthman.com and book an appointment. Then you can get an appointment there. But phone number, I don't give it out because there are many people. If I give it out, then I'll be in other words, there are many. If I give it out every time, I will be answering calls. I'll not be able to work on my patients. So pass through the website and book an appointment. They will schedule, and then you'll be able to talk to me. Then another question on TikTok. This is the Kalechi Shedrack. Hi doctor, my wife took 3-month injection pills. Took 3-month injection pills. What do you mean, Kalechi? Is there a 3-month injection pill? I've never seen that. At 19th of April 2023, and then took another one on 18th of July 2023. But now my wife is pregnant. What might be the cause of this doctor? She tested for 3 months pregnant. Now, the reason as to why someone may conceive, may get pregnant, even after using family planning medicines, for example, the injection. Number one, the person may take the injection, may get the injection after conceiving. For example, you're testing a 3-month pregnant, You're testing that you're 3 months pregnant. Maybe by the time you got that injection, you had already conceived. That is number 1. Number 2, you may take a low dose injection. Number 3, the injection or the medicine might have been expired. Number 4, this is our excuse as doctors. We usually tell you that the method is not 100% accurate. But of course, that is true that family planning is not 100% accurate, because we've seen people having family planning, but again, they end up conceiving. Let me have Avatar Girl. Avatar Girl, how are you? Where are you calling from? And what is your question? Avatar Girl.
Hello, good evening.
Good evening to you.
My name is Avatar. I'm calling from Italy.
Calling from Italy. Yes. What's your problem? What's the question?
Yeah, I don't know if I can really ask this question yet, because I wanted to ask about twins, if someone is having ovulation, menstrual cycle, and which date can the person have, like baby twins, is looking for baby twins.
All right. First of all, getting twins, you don't need to target days. Getting twins, you don't need to target days. We target days when we are now, number 1, when we are planning to, maybe we want a certain type of sex. Maybe you want a baby girl, maybe you want a baby boy. That's when you time when to have sex. But for twins, you can have sex on any day and twins will come. But they can be stimulated by you taking some, we call it hyperstimulation. You stimulate the ovary to produce at least 2 eggs, and then you can conceive. So for twins, you have to get medicines. So you're supposed to take medicines, then you can have twins.
Yeah, like my mama have twins twice, so I don't know.
Of course, when like I've always taught that when your mother or your father had twins, or you yourself, you're a twin, there are very high chances that you can have a twin pregnancy. But of course, you can increase your chances by taking some medicines. There are medicines like Litrazole and so on that can be used. All right, thank you so much. Let's have someone else. And this is Bridget Enieme Mawen Peter. Is it possible to have your number? No. Mutuzo Rachel, I have failed to know the day I conceived because I took a pill after 24 hours. All right. Sorry about that, because we've discussed about that. Rose Natwera, you're saying, hi doctor, any medicine to treat heartburn and bloating in pregnancy? Yes. You have to take you take medicines containing magnesium, medicines containing smethcone, all those medicines. So there is a very good syrup. My technician is making me laugh. There is a very good medicine which is called Nutraflux. Okay, Nutraflux. That one can trap gases and neutralize the acids. It's a very good medicine, Nutraflux. Then omeprazole. Omeprazole is the medicine of choice. Because you see, people want serious, I've usually prescribed medicines to people, but someone tells you, doctor, I want those serious medicines. They have ever given me these ones. They do not work on me. When you are pregnant, the other medicines for PUD or for ulcers are contraindicated. For example, so omeprazole, rabeprazole, pantoprazole, all those medicines are not supposed to be taken during pregnancy. So the medicine of choice during pregnancy for ulcers is omeprazole, popularly known as OCD. That is the medicine of choice. Then, of course, you can top up with antacids like the magnesiums. You can take medicines containing smethcone, those lithium, and so on. Those medicines can be used. All right. Let me have Rovens. How are you? Where are you calling from? And what is your question? Rovens.
Good evening, doctor.
Good evening to you. How are you? Where are you calling from?
I'm calling from Dubai.
Mm.
Like me statin or suspension plus some tablets. I got fine. But when I travel this side, every after 3 weeks, the wound is recurrent. I don't know what would be the problem.
Those sometimes it's as a result of oral infections. Now it may be you have to check the way you're brushing. Do you brush on a daily basis? Do you brush every after eating food? That is number one. Number two, sometimes people tend to take cold food, cold meals. So avoid taking cold meals. Take meals that are hot or that are warm. Then make sure that you brush every after a meal. That is the prevention.
Maybe food, but brushing I do.
I know. So try to take warm food, and also even though still those ulcers in the mouth, you can use you can wash your mouth with salty water. Warm salty water can help also.
Okay, thanks, doctor.
Welcome. All right, let's have another question here. Okay, the question. Zainabu Kidere on YouTube, you're saying, I have a problem on missing period for about 5 years. After being operated from fibroids, till today, no menstruation, I went for hysteroscopy. Now, you might have been operated for fibroids, but there are still fibroids there. Because when you have fibroids, you may not have your periods regularly. That is number one. Number two, check your hormones. Your progesterone may be low. Okay? Your progesterone may be low. First of all, fibroids themselves can cause amenorrhea. Fibroids, I've always been talking about it here. Fibroids can make someone fail to go into their periods. So, check about those ones. I think the last person here, Charity, it's you, has been asking. Okay, let's go to Mary Love. Mary Love, how are you? Where are you calling from? And what is your question? Mary Love, you're off? Okay, let's get these questions done also. Mr. Lucius is saying, good evening, doctor. I watched that video of where partners can calculate to convince a baby girl. Give us more tips, thank you. I think I've already talked about it. I've already talked about how you can have a baby girl. I've already talked about it. All right, Softy Vicky, how are you? Where are you calling from? And what's your problem?
Hi, doctor.
Hi.
I'm calling. I'm here in Uganda. I'm just here in Buziga.
Buziga. What's your name and what's your question?
Yeah. Victoria. And my question is, doctor, I have
You're not ready for the question? Okay, because you've muted yourself. Okay, let's have someone else. Mary Love. Mary Love, are you back? Get us your question. Okay. Let's have Gliz Beck. You people have names. Gliz. Yes, Gliz Beck. How are you? Where are you calling from? And what's your problem?
I'm called Fatia Hassan. I'm calling here from Dubai. Doctor, why do I have cramps 2 times? Before and after?
Before and after. Before, like how many days before?
3 days.
That is normal. Yes, we have what they call perimenstrual peridysmenorrhea, perimenstrual pains, intramenstrual pains, and postmenstrual pains. So it is normal.
To have what?
Yes.
But before it was not there.
Yes, and it has now developed.
Okay, thank you. I was so worried.
No.
What is wrong?
No, you shouldn't.
Okay, thank you.
It is normal. All right. Thank you so much. Thanks for watching us, and share our live with for others to also watch. Okay, let me have questions on YouTube. Nezima Iman is saying, hi doctor, can fibroid come back again after surgery? But surgery was January 2023. Up to now, I'm not pregnant, and I'm planning to get it next year. Yes, fibroids can reoccur. Very, very true. Fibroids can reoccur. So fibroids can reoccur. I think Miss Isman, you've gotten that. Iman. Mase Mwale is saying, hi doctor, I'm back. I'm 30 years. My cycle is just between 28 to 30 days, and I have children. And I have trying to conceive for a year now. So what is the problem now? Your cycle is 28 days. What exactly do you want? Mase Mwale, please clarify your question. What exactly do you want from us? Let's have Twinomu Juni. Twinomu Juni, how are you? Where are you calling from? And what is your problem?
Hello, doctor. I'm Twinomu Sanema. I'm calling from Saudi Arabia. And my question is, it's like, I don't know whether I have something, but whenever like we are having fun with...
What is fun? What do you mean by whenever you're having fun?
In my brain, they... They get a lot.
Your question is not clear, please. Is it our internet?
It is like...
I think your internet is not stable. We are not hearing you. Please repeat your question and be fast. Your internet is not stable. We are not hearing you well. Repeat your question.
Yeah, my question, doctor, is, are you getting me now?
Yes.
My question is, when we are like, me and my husband, whenever we are having sex,
Yes.
my breasts can get a lot of liquid.
During the act.
Any problem with that?
During the act. Like you get fluids, you get breast discharge when you're having sex. Is it?
Yeah.
And after sex, after having sex, when you squeeze your breast, do you see that discharge again?
No.
So that's okay. If you could again see the discharge after sex, there would be a problem. But if the discharge comes during sex, it is okay. That is overstimulation. Maybe that person will, has stimulated you a lot and you really feel so high. Yes, you see, some people, when they get stimulated, people do crazy things. People do crazy things, so maybe that is one of the crazy things you do. People can do things during sex. People can do things. Someone told me that when her wife comes, when her wife comes, when she reaches the climax, she can look at him like this. So,
Thank you so much.
welcome. Nice time. Let's have another question. Okay. This one is Kelachi, you're back. You're saying, meanwhile, doctor, she doesn't want to carry the pregnancy. What can I do? Really? Kalechi Shedrack, where are you? How are you? Really? You're telling me when your wife doesn't want to carry the pregnancy, what can you do? Really? I don't know. This is your pregnancy. This is your pregnancy. It is between you and your wife. If she doesn't want to carry the pregnancy, then you know what to do. I can't give you that answer. You know what to do. You decide, sit with her, and decide on what to do. Babatude Deborah, Babatude, what? This name is from which country? Where are you? Where are you? Babatude Deborah is saying, doctor, what can I do in case of premature follicular rupture? Premature follicular rupture is usually a hormonal problem. Okay? Premature hormonal rupture is usually a hormonal problem. And what you're supposed to do, I will request you to first do a fertility hormonal assay. Okay? You do a fertility hormonal assay. You first do a fertility hormonal assay, check the level of your hormones, and depending on how the level of your hormones are, then you can get treatment. But some of them are hormonal in origin, but others can even happen without any cause. What some people can call idiopathic. Okay, idiopathic. So what you're supposed to do, first carry out a fertility hormonal assay, then see what you can do. Of course, depending on the results of the hormonal assay, you can get the medicines. Okay? Mary Love, I don't know why you're on the live and you don't want to, so you can take.
I'm now ready.
All right, you're ready. What's your problem? Where are you calling from? And what's your question?
I'm here in Saudi Arabia. Doctor, I have this. My question is, last year I used to have this food, just when I am there, or if it is during ovulation, I don't know. So I will feel, feeling a white fluid.
A fluid from where? From your vagina?
The white one. Then
Yes.
after comes this one, the one that is, how can I call it? Then after I get muscle tights in the thighs.
That happens during ovulation. There is no problem.
So even now it has repeated for real.
Does it happen throughout, or it happens on certain days during the month and then it disappears?
It happens. Last year it would happen frequently after every month, but now it reduced. And now the way it reduced, the way it comes in a rough way.
Yeah, it comes during for 2 days, 3 days, and then it disappears.
Yes.
That is that you just need to take painkillers. You have no control over that. It's natural.
Another thing, why does it happen when I'm going in my period?
Yes, it happens. It can happen. Some people it happens during ovulation. Others it happens during menstruation. It is a hormonal fluctuation. The hormones that lead to your menstruation are the same hormones leading to this. If you don't want it to happen, it means you have to stop menstruation.
So there is no way of doing it. Then another, why do I?
No, that question is enough. First, wait. Let's first answer other people. So, Babatunde, I've told you that the person who was asking about premature follicular rupture, I've told you that you do a fertility hormonal assay, find out the level of your hormones, especially the FSH and LH. But also, just know that you'll also make sure that you test the HCG levels, the level of your human chorionic gonadotropin hormone. Check the level of HCG in your blood. In most cases, HCG is low. So, and when HCG is low, then you will take an HCG injection. By the way, HCG injections can be self-administered. You can even take the injection yourself. I hope that is very clear to you, Miss Babatunde Deborah. Gracious Saulai is saying, hi doctor, is it possible to buy Pagono and Metrod over the counter without prescription? These are prescription-only drugs. Prescription-only drugs are supposed to be taken after a doctor's prescription. So you can't just go to the counter and buy the drugs. Mary Love, ask your last question and we say bye-bye to you, then we get some other people. Mary Love, ask your last question. Okay, let me get someone else here. Oh. All right, Doreen, how are you and where are you calling from and what's your problem? Be louder so that everyone can hear you.
I'm fine, doctor, and I'm calling from Saudi Arabia.
Yes.
Doctor, I have two questions.
Yes.
One question is concerning rheumatism.
Rheumatoid.
Rheumatism arthritis.
Rheumatoid arthritis, yes.
Yes. Because I've been suffering for almost 2 years, but I'm on just painkillers. But I'm told that it is not cured. Is it true? It has
Yes.
medicine?
Rheumatoid arthritis is a genetic disorder, okay, whereby actually someone who has rheumatoid arthritis, you have your immunity fighting against your immunity, like you have body cells that are fighting against your internal steel body, your tissues. So that is a disease which can become very, very difficult to treat and very difficult to manage. So with rheumatoid arthritis, you survive on those painkillers and steroids. Someone mute yourself, please. You're causing a lot of havoc here. If you don't mute, I will take you off. So with rheumatoid arthritis, someone... So with rheumatoid arthritis, someone has to survive on methotrexate. There are some medicines called methotrexate. Someone has to survive on drugs called drugs like prednisolone and so on. But it is not curable, okay?
So doctor, I have to be on painkillers until further notice.
Not only painkillers, you alternate painkillers with steroids and also a drug called methotrexate. All right, thank you so much. Let's have another question. Please, someone mute yourself. You have a very strange...
I have another question, doctor.
No, you'll ask later. Just a minute. This person, user 5753, please mute yourself. This person, I'm taking her. Don't mute. Okay. Then we have another question. Fufu is saying, Fufu on YouTube, you're saying, good evening, doctor. My periods is irregular from 30 to 35 days, 34 days, but I don't get pregnant. I want to calculate like you learned before. All right. So if your cycle is, for someone who has a 30 to you're saying 30 to 34 days cycle. So if you have a 30 to 34 days cycle, we shall consider 30 days. Okay, we shall take 30 as the length of your menstrual cycle. So we shall take 30 L as 30. So the length of your menstrual cycle is 30. Those who are live, you have to give me this answer. So if you have 30 as the length of your menstrual cycle, what you're going to do, say 30 minus 18. What do we get here? Okay, someone is saying we get 12. So 30 minus 18, you get 12. Then 12 plus 4, what do you get? 12 plus 4, someone is saying 16, you get 16. Then 16 plus 5, what do you get? Give me the answer. Okay, you get 21. So, for you is asking about your ovulation day, all the days you can get pregnant at with a 30 days cycle. It's this person in user. It's user. Okay. This one is making this one user the topmost. Failed to mute that person. That one. It's fading. Okay. Okay. Doreen, please mute yourself. Doreen, you're causing problems here. Everyone is not hearing because of you. Mute yourself. Okay. Very good. We even took away someone we thought was the person causing noise, but it was you. That person we took off can ask to be invited again. If your question is the days you're going to be fertile, so that means from day 12 up to day 21, all these days you can have sex. All these days you can conceive. From day 12 up to day 21. But the most fertile day, of course, out of this is 16. If you have sex on the 16th day, it is likely, you have very high chances that you'll conceive on the or you'll conceive on the 16th day. No, your limit 254 is saying no. Every young empire is saying, please calculate ovulation for 24-day cycle. Ovulation for a 24-day cycle is simple. If your cycle is 24 days, say 24, so you shall say 24 minus 18, what do you get? Give me the answer. If you don't give me the answer, 24 minus 18, what do we get? Someone give me an answer. Okay, people are giving me the answer. 6, you get 6. So get 6 plus 4, what do you get? 6 plus 4, we've gotten the answer. Henry Tumwebas, we've gotten the answer. Now give me 6 plus 4. Rovens is the best in mathematics here. So, okay, 10, thank you. 10, so 10 plus 5, what do you get? 10 plus 5, what do you get? Okay, people are giving me 15. Thank you. So, now, if you have a 24-day cycle, you are fertile from the 6th up to the 15th day. All these days, you get pregnant if you have sex. Then, on the 10th day, that is your ovulation day. And this is the day you have very high chances, around 99% chances, of getting pregnant if you have live sex on that day. Okay, let's have another question here, and it's coming from YouTube, saying, hi doctor, I'm from USA, all right. Linda Murela, if one is a victim of preeclampsia, can it come back in the future pregnancy? Yes. Preeclampsia can come back. Actually, when you have preeclampsia, because people may ask themselves, what is preeclampsia? Preeclampsia is a condition whereby a woman develops high blood pressure during pregnancy. With preeclampsia, you develop high blood pressure during pregnancy. And that high blood pressure starts on the 20th week. At 20 weeks of amenorrhea, that's when you get that high blood pressure. Plus, of course, some other signs like sweating, urine will be having proteins, and so on. That is preeclampsia. So if you've ever had, actually, one of the risk factors for getting preeclampsia is history of preeclampsia. If you've ever had preeclampsia, then you have high chances of getting preeclampsia again. Okay? So, Doreen, you had another question. Please, can I know what you wanted to ask? And then we go to someone else.
Doctor, my question is about abdomen pain. I always feel pain before my menstruation period and after. And even when I'm not going to menstruate, I feel pain. What could be the cause?
All right. Pain during menstruation, to some women it is normal because it is as a result of hormonal fluctuations, okay? But some women have conditions like adenomyosis and endometriosis that causes that pain. So I have already said that pain during menstruation can be primary or secondary. Primary pain is when someone has had, please mute yourself when you're not asking a question, otherwise we shall take you off. Mute yourself. So pain during menstruation can be primary, that is primary dysmenorrhea. We also have secondary dysmenorrhea. Primary dysmenorrhea or primary period pain is when someone has had period pain from the time they started getting periods, from menarche. Like, for example, you started your periods at 12 years, and since then you've been having menstrual pains. That is primary. But secondary, you find someone never used to have pain during periods. But when they reach around 30 years, or 40 years, or 20-something, they get those menstrual periods, or dysmenorrhea. That is secondary dysmenorrhea, or secondary menstrual periods, menstrual pains. Now, with primary menstrual periods, it is usually and commonly hormonal related, and that is difficult to treat or to cure, and those people have to survive on painkillers, on pain medications. But now, if it is secondary, then it has a cause. For example, someone may be having endometriosis, someone may be having adenomyosis, someone may be having adhesions or PIDs. So for that one, you can investigate, do tests, do an ultrasound scan, do those various pelvic examinations, identify the cause, then you can treat that if it is treatable. I think that is clear.
Dr. Mine is not a primary. I used not to feel pain since my childhood. But right now I'm 30, but I feel too much pain.
So that means it is a secondary thing, and therefore you have to do those tests I've talked about to identify the cause and treat the cause. You may be having adenomyosis, endometriosis, you may be having PIDs, or any other problem. All right, thank you so much. Have a nice time. Let's have Winnie. Winnie, what's your question, please? Okay, let's have Sanex. Samex, what's your question? Where are you calling from, and what's your question?
I'm calling from Uganda.
Yes, how are you, and what?
I want to ask a simple question that I married a wife and I took like 3 years minus producing. After 3 years, I produced a child. After producing a child, I took again more 3 years minus producing. Again, and the woman is pregnant now again after 3 years. What was the cause?
All right. Some people are not so fertile. People are not fertile like others. Some of them, they have problems with their hormones. Okay, and then they have to target, okay, the period when the hormones are a little bit high for them to conceive. So it can be a problem of it can be a hormonal problem. It can be a problem of infection. But for you, for that one, for that particular case, that is likely to be a hormonal problem. But like they say, that even a watch, someone in quotes, a dead watch, okay, a dead clock can be right at least once in a day. And therefore, that person who has a problem with hormones can still conceive if they target their ovulation days, or even because you may spend three years when you're sleeping with this lady, but you're not having sex on the ovulation day. But maybe that day the woman conceived, it was your ovulation day. So it's just like that, and it is usually a problem with hormones.
Is it a woman or is it a man? Because
It can be both. it can be both. If some men have low sperm count, and when you have low sperm count, it becomes so difficult for you to impregnate a woman. If you have low sperm count, check out my video on YouTube about low sperm count and how it can be treated. So, but still, because you have low sperm count, because we have a difference between someone having no sperms at all, azoospermia, and then someone having few sperms. So that one who has no sperm at all cannot impregnate a woman. But you will find that someone has some sperms, okay? Some sperms are there. So the more time you have sex, you will increase the chances of making someone pregnant.
But now my parents give me pressure.
Oh, you're asking many questions. I have very many people on live. I've answered you, please. That is enough. Let me have some other people. There are many questions here. I think I've solved your question, isn't it? All right. Let me answer a few other questions here. I'm going to go to YouTube and answer a few questions. Hi, Doc. I've been there. This question. Hi, Doc. There has been a change in menses. This question is not clear. Ever since I gave birth to my son, and I have been menstruating too much and with stomach. Your question clearly. I'm not getting your question very well. Please phrase it very well so that I can answer you. Okay. Justin Nabidio, hi doctor, my husband seminal analysis report, total sperm count 70.5 millions. Your report is not clear. Your report is not clear. Please make sure that the report is clear. Give us a report, and when you're giving us a report, you give us a reference range, because different labs have different reference ranges. Nena Safaris on YouTube, you're saying, how can one unblock cervical blockade? Now, cervical blockade, you can do dilatation and curettage. Dilatation and curettage, that is how you can unblock the cervix. Irene Cathon is saying, I removed my implant 4 months ago, no period yet. I have backache, cramps, but no period. Yes, you removed your implant 4 months ago, but no period. That is very possible. Actually, implants, sometimes you can even spend up to 6 months without seeing your periods. It is very possible. So it's the effect of the levonorgestrel, which is impregnated or which is put in your implants, in the family planning implant. Nena Safaris, how can one unblock cervical blockade after miscarriage? I've already talked about, you do dilatation and curettage. I've talked about it. Nena Safaris, how can one? Okay. Zainab Williams, hi doctor, what is rough estimate to get an IVF with you? The amount, no please, this I can't answer this. With an IVF, you just come, you get tests done, and then we identify what you need, and then the cost can be given to you. All right, let me have Helgas 85. What's your name? Where are you calling from? And what is your question? Be fast.
My question is about, I'm from Zimbabwe. I come from Zimbabwe. My question.
You come from Zimbabwe?
It's now 4 weeks, but I don't even see. Yes.
What's your question?
My question, it's not 4 weeks, but I don't even see my period. I take a pregnancy test, but it says negative. So I'm still feeling some pain and lower pain and some symptoms, pregnant symptoms. So I don't know what to do. What can I do?
You're having signs of pregnancy. Sometimes it can be psychological. Some people get signs of pregnancy when they are not pregnant, but it is usually psychological, especially when you want to get pregnant badly. When someone wants to get pregnant badly, even if they get some vomiting as a result of malaria, they will think that they are pregnant. So, what you're supposed to do, first of all, because you did the test, it is also possible that you're pregnant. You did the test, but where did you do the test? Because you may do the test early. If it is not yet 10 to 14 days after that sex, after conception, then the test may not be positive.
14 days.
It's 14 days. Then
14 days after.
40 days.
14 days after.
14 days after, and you're not.
Ovulation day.
Sometimes ovulation.
After ovulation day. Yes.
No, you still have to wait, because it's not that conception only happens during ovulation. You might have conceived after ovulation. And when you conceive after ovulation, then you need to first wait for more days. Now, what you're supposed to do, first give it another week. If you don't menstruate within that week, then you can now investigate, you can do tests. Now, come back on the next live next week on Thursday and tell us if you've still seen your periods again. Then we shall start from there.
Okay, doctor, thank you so much.
All right, thank you. Then we have Memory Shimwak on YouTube. You're saying, good evening, doctor. I have blocked tubes. What drugs can I take to make them patent? I'm 33 years prime. Now, I want to make this one very clear with everyone. There is no medicine you can take to unblock tubes. There are no drugs you can take to unblock tubes. Tubes have to be unblocked physically. Physically, there is a procedure called hydrosalpingolysis. You can do cannulation. You can use laparoscopy to unblock the tubes, but not medicines. So there is no medicine in the whole world that can be used to unblock tubes. That one is not there. Tubes are unblocked physically. Okay, let me have a question from Huda. Huda, how are you? Where are you calling from? And what is your problem?
I'm doing well, doctor. My name is Huda, calling from Uganda. My question is, I have a kid of 5 years now.
You have a kid?
I went to the hospital.
Hold on.
Yeah.
You have a kid of 5 years?
Yeah.
That is no longer a kid, that's a big goat.
Okay, I have a baby of 5 years.
Okay. Sorry, we don't call children kids. I feel so bad when someone calls a child a kid. Kids are for goats. So ours are called children, babies, like that.
Okay, I'm sorry.
Is 5 years, yes?
She's 5 years. I went to the hospital. They tested her, like her headaches, but her breathing was bad. So they told me she might be having asthma. I studied the tests of asthma. Then they told me she's positive with asthma. But my worry with her is she's taking the treatment well, but her voice is like it is going off. I don't know what might be the cause of that.
It is still asthma. It is still asthma because of those allergens. But there is a spray called mometazone. There is a spray called mometazone. Try to use it. You spray in the mouth and then see if the coarseness can go.
Okay.
Yeah, it's called mometazone. Second question, I have very many people, please. Let's have that only. I have many people. There are many people here.
Please.
Okay, be first.
Yeah, my question is about when I'm menstruating, it's like 3 to 4 days. I have a hard thing coming out. It is too thick, something like a stone. What is the main cause of that?
During menstruation?
Receive it in a painful way. Yeah.
It is normal, and it is as a result of hormonal fluctuations. It's very normal. No problem about it, as long as it goes after.
Okay.
All All right, thank you and have a nice time. Let me have some other questions. Please, whoever is on live, please mute yourselves so that others we can hear each other very well. Mute yourself. I call you, then you can unmute and speak and ask your question. But before I call you, please stay mute. A question from Zainab Williams. Hi, doctor. What is rough estimate? Okay. Someone have 24-day cycle. Is it normal? Yes, a 24-day cycle is normal. Blessing a baby, 24-day cycle is normal. Papa give for fun. You're saying, hi, doctor. Hi. I want to ask you a question. Please go on and ask. Kerechi Shedrack is saying, please, doctor, my wife tested for closed cervix according to scan. Well, she had born 3 children, even without the aid of any midwife nurse. What would be the cause of this, doctor? I've talked about blockade of the cervix. It can be as a result of infections. Infections can cause blockade of the cervix. Dilatation and curettage, even delivery can cause blockade of the cervix when there is impaction of substances there, especially when there is an adhesion. Another question here, Zainab Kidere. Zainab Kidere is from Kenya. She's saying, the question is gone. Let me have someone here, Shamwabi. Wow. These names on TikTok, people. All right, so Shamwabi, how are you? Where are you calling from, and what's the problem?
I'm fine, thank you. How are you, doctor?
Good.
I'm Shamim from Uganda.
Shamim.
Doctor, I experience pain when I'm going into my periods, or when I'm in, or before, or after. And even the pain, sometimes it is continuous. On my right side of my pelvic, what could be the cause?
You may be having a PID, you may be having an ovarian cyst, or it may just be normal. But when you say pain on one side, so I would advise you to go and do an ultrasound scan to look for a PID. Of course, for ultrasound scan, you don't need just the PID. You go for a pelvic examination by manual. Then you also do an ultrasound scan to find out if you don't have a cyst. If there is nothing like that, then that is normal, and you have to just keep on painkillers.
Okay, thank you, doctor.
All right, thank you so much. Let me have another question here on YouTube. This one is saying, please, doctor, my wife is tested for... Zainab Kidere again from Kenya, result of hysteroscopy was no follicle fluid. Oh, I don't get. What do you mean? Rachel Sia is saying, doctor, I gave birth to my first baby by C-section 12 years ago. How can I know if I can give birth normally with my second baby, because I'm now pregnant again? One of my next videos, I think it will be after this video. Tomorrow, I'm releasing a video on my YouTube at exactly 8 p.m., which is talking about how can you know the father of your child? Because we've seen most women conceiving, you get pregnant, but you don't know which guy is responsible for your pregnancy. And that happens because you had sex today with someone, then 2 days later, you've had sex with another person. At the end of the month, you are pregnant. You don't know who impregnated you. That video is coming out tomorrow at exactly 8 p.m. on my YouTube channel. Please tune in and understand how you can really get, because you need to be saved from this. You'll give a child to a person who is not the father of that child. So tomorrow at exactly 8 p.m. we are talking about how you can identify the father of your unborn baby at 8 p.m. That is 20 hours East African time. It's when we are premiering that video. Now, the next video will be talking about cesarean section and how you can conceive very well, how you can have vaginal birth after cesarean section. So, Rachel, CEO, the next video after the one of tomorrow, I'll be answering your question because it's wide and I need to give it a good picture. So it's one of my videos I release. Another one is called Nga Kamatuka. It's saying, how long does it take for depot to wear off, and can ovulation be only one day? I only had, yes, ovulation can be one day, and the depot can wear off between 3 months and 6 months. All right, let's start with Brenda. Brenda, how are you? Where are you calling from? And what is your question? We are time bad.
I'm calling from Kawembe. How are you, doctor?
I'm good. What's your question?
Yeah, I have a question. I give birth. Now the baby is 4 months. But I'm paralyzing and my heart is beating too much. I don't know why.
Oh, that is likely to be hypertension. Go and do
The heart is beating.
test for hypertension, test for high blood pressure. Test for high blood pressure, maybe also sugar levels.
Okay.
Yes. All right, we now have, I think we have only 5 minutes to end this live. Let me have now brief questions. Lady SP, what's your question? Briefly, we are ending the live in 5 minutes. Lady P, Lady SP. All right, it's not on. User 573 something. What is your question? Be very loud. All right, we close these ones. Let me have... Yes, how are you? Where are you calling from? And be very fast. We are winding up. We are closing the live.
Okay, please. I'm Lady SP. My name is Sylvia, calling from Germany.
You're calling from Germany. How are you? And what's your problem?
Yeah, I'm good. I'm good. I want to ask this question. I had an operation.
You have what?
And my uterus was taken out. I had an operation.
You had an operation and your uterus was taken out. Okay?
Yes, but still every month I still have like small blood coming, like normal, like menstruation. And it's over. I always see it every month like that. And my second question is that, but you use one?
No, let's answer only one. Let's answer only one. Time is up. I want to close the live. But it is, if they can take out your uterus, that is hysterectomy. Some people don't do total hysterectomy. They can take half of it, or they can take a small bit. This is what I mean. This is what I mean. You see, with hysterectomy, this is our uterus. This is the uterus. So sometimes during hysterectomy, this is our uterus. Sometimes during hysterectomy, the doctors may cut off. You said the uterus was taken out. The what? It was taken out. That is hysterectomy. That is removing the uterus. So sometimes they take half of it. That is called so it can be total abdominal hysterectomy or sub-total hysterectomy. So if you're still seeing bleeding, that means they did a subtotal. They didn't remove everything. They left some part. Okay, especially the upper part of the cervix and some lower part of the womb was left there, and they only removed the other big part of the womb, and that is called a subtotal hysterectomy. So, not that everyone that does everyone that does hysterectomy or everyone they remove the uterus will not be able to conceive. To bleed, to have menstruation. Some of them will have menstruation, especially if they did a subtotal hysterectomy. My time is up. I think I cannot continue any more questions for now on TikTok, and I will only answer one question on YouTube. This one is saying, I have menstrual cycle 5 September. When am I going to have another one? Of course, I don't know when you're going to have another one, except if I knew the length of your menstrual cycle. Can someone explain to me how